Assalamualaikum doctor. In this video I am discussing about DMSA scan. So it comes recently Egypt 2024, just few days ago. That was 30% scar patient. So first of all, DMSA means dimarcapto succinic acid. The consent, first of all, the communication, we take the IRCAP, introducing myself, making repo, taking the consent, telling my agenda and the prior knowledge. Okay. So first of all, I am here to talk to you about our plans for Ali, and hopefully at the end of the meeting I can take your agreement. So you can draw a picture of the kidney, ureter and the bladder like that. So but first, do you want anyone to be here? No. How much do you know about Ali's conditions? So mother is telling Ali has repeated infections in his urine. They told me to come here and to do certain procedure. I do not remember what is the procedure. Okay. As you mentioned, Ali has repeated infections in his urine. So our consultant asked us to take a consent for a procedure that is called DMSA scan. Did you hear about it before? No. So DMSA scan, it is a procedure in which we will inject a specific dye or chemical substance through Ali's blood tubes, and we will take a picture of his kidney by a special camera. Why you are doing that? Okay, it is very important. It tells us about the size of the kidney and if injured or damaged tissue in the kidney. Okay, why it is different from jelly scan? Because the jelly scan tell us about the size of the kidney but cannot tell us about the structure of the kidney and whether there is a damaged tissue or not. Am I clear? Okay. Could I explain for you the drawbacks of this procedure? Okay. So for any procedure, as you know, there are some drawbacks. So there is some drawbacks of the DMSA scan, some risk of allergy. We will be ready with a medicine to give him if any reaction appeared. Also, there is some risk of radiation if it is, and it is equal to what we get from the background environmental radiations and very long period of time. Are you with me? Okay. So mainly the side effects we understand, some allergic reactions, but we are ready to prepare, and also some radiation problem these are. So radiation problem we get from background environment. Radiation is very long period of time. Okay. Now are you with me? So is this damage to kidney diagnosed by DMSA scan is reversible? No, I'm so sorry to tell you that the damage is irreversible. So why you will do that? Actually, it is very important to know whether he has damaged tissue or not. The amount of damaged tissue and whether the damaged tissue at one side or both sides. So can you explain more? So for sure, for example, if one side only damaged and small may not need follow-up. Just discuss it with the kidney doctor according to family risk factor having hypertension. But if he has both sides are affected and large amount of damaged tissue, we need to measure his blood pressure every year. Do kidney function test every 3 to 4 years, and when he grows up, he has to follow with kidney doctor. So DMSA scan, we need to know there is any renal scar present or not because follow up needed. Okay. So how now he has some urgency and frequency. Can we do that? No, he has to wait another 4 to 6 months. So remember, during UTI time, we will avoid that. We cannot do while he has UTI. Also, it will give us inaccurate results. So what is the procedure? So procedure is that for first 24 hours, he plenty of fluids as much as possible. Allow the dye to go out from his body. Also, if he is taking his medications, to take it as usual, and he should go to toilet as frequent as he can and wash his hands as usual. I am pregnant. You should avoid contact with his fluid, pee, poo and throwing up. Remember, pregnant person can be avoided. So if he wears nappies, he must change his nappies as frequent as you can, and you have to dispose the dirty nappies and wash your hands very well. So this is all about DMSA scan. At the end, we give the summary, websites, leaflets, support group and consents. Thank you.